How do you recognize dangerous flu signs in a baby? When caring for a baby with the flu, knowing what signs indicate a serious problem can make all the difference. Infants, especially those under 6 months, are more vulnerable to complications from influenza because their immune systems are still developing. And like older children or adults, babies cannot tell us how they feel, so caregivers need to be extra vigilant for subtle or sudden changes in their behavior or health. Common flu symptoms in babies include fever, cough, congestion, and fussiness. They might also show signs like poor feeding, increased sleepiness, vomiting, or diarrhea. These symptoms can come on quickly and may seem worse than a regular cold. But what really signals trouble are certain warning signs that need immediate medical attention. If your baby is having difficulty breathing or breathing very fast, that's a red flag. Look for signs like grunting, nasal flaring, or ribs pulling in with each breath. If you notice their lips or face turning bluish, it indicates a lack of oxygen and requires urgent care. Persistent vomiting, especially if they cannot keep fluids down or if the vomit is green or yellow, is another serious sign. Severe diarrhea, with more than 6 watery stools in a day or stools containing mucus or blood, also warrants quick medical help. High fever in a baby under 3 months old should never be ignored. If their temperature reaches 100.4 degrees Fahrenheit or 38 degrees Celsius, contact your healthcare provider right away. Signs of dehydration such as a dry mouth, a sunken soft spot on the head, fewer wet diapers than usual, or crying without tears are also concerning. If your baby is unusually drowsy, difficult to wake, or not responding as they normally do, this is a serious warning. Seizures in a baby with flu symptoms are emergencies and requiring immediate medical attention. Sometimes, a fever or cough might improve and then suddenly worsen again. This could be a sign of a secondary infection or complication. Babies with existing health issues like asthma or heart problems may deteriorate more quickly, so close monitoring is essential. Newborns are especially at risk because their immune defenses are still maturing. Any sign of illness in a newborn, especially a fever, should prompt you to contact your healthcare provider immediately. If your baby shows any of these warning signs, do not delay seeking medical care. Even if symptoms seem mild but you feel worried, it's always best to consult your pediatrician. Early evaluation and treatment can prevent serious complications. Remember, vaccination of household members and anyone caring for the baby is the best way to protect infants from the flu, since babies under 6 months cannot be vaccinated themselves. If your baby does get the flu, antiviral medications prescribed by a healthcare professional can help lessen the severity and duration of illness, especially if started early. Keep a close eye on your baby's feeding, hydration, and breathing. Do not give over-the-counter cold or flu medicines to infants unless advised by a doctor. Trust your instincts. If something feels wrong or your baby's condition worsens, seek medical help promptly. Recognizing these signs and acting quickly can make all the difference in keeping your baby safe and healthy.